Hello, bonjour. Hello, Dr. Magarinos.
Yes. Hello, Marie. Nice being with you again.
I'm happy to see you again. Thank you for accepting part 2 of the microbiome information we want to share with the world.
Yeah. Oh, my pleasure. It's always a pleasure.
I'm so happy we're taking the time to offer everyone information about the mouth microbiome, because we're starting to hear more and more, but it's still very new information for most people out there. And I'm sure you see, as a practitioner, I see as well, a lot of people that have issues in their mouth, either with gums, either with teeth, either with breath. And oftentimes they have also other issues with digestion, gut issues, inflammation, and we'll also link this to how the bacteria in the mouth can link to hormones, especially for women. So that's so interesting. Thank you so much for being with us tonight.
My pleasure.
How we can explain to people your experience before being a naturopathic physician that goes and tries to see the body in a very full and global way. You were in more of a conventional medicine, but specifically as a mouth surgeon and periodontics, right?
Yes. Yeah, that's my original training. And actually, that was the reason why I started. The conventional dentistry doesn't give really proper answers for understanding what's going on in terms of mouth disease. They tell us that there's an infection or an overgrowth of certain bacteria that they're establishing in certain areas of the mouth, and they're causing damage. And the solution is getting rid of them, and of course treating the areas which could be affected, and that's pretty much it. That's the standard of care for dentistry in terms of oral dysbiosis. And that answer never really fit me. That's the real truth, that I was not satisfied with the answer that was given. And that led me to this journey of trying to figure it out, what's going on. And I knew somehow that there was something else that is beyond the mouth cavity. And I had that gut feeling. It's funny that I had that gut feeling for a long time. I was pretty much the rebel, weird guy in the dentistry school that was asking these weird questions and not really being conformist with the given solutions. And besides that, after years of practice and applying that model, you could see that nothing really was working. The progression of all these diseases kept going regardless. You can put all the antibiotics in the world, you can make combinations, doing everything based on evidence and research. Still, after 3, 6 months, a year, doesn't matter, it was a certain time frame for each person, you will see them coming back with the same problem over and over. Now, after more years, you start realizing something else. All these people, they have other morbidities, they have other conditions. They don't just come to your office because they have a mouth problem. If you read every clinical chart, all these people with especially advanced periodontal disease, they also come with diabetes. They also come with metabolic disorders like high blood pressure, and multiple other conditions, including mood disorders and hormonal imbalances. So that was triggering.
I just have a question maybe for my more French listeners.
Yeah.
Just to explain, when we're talking about the gut, the mouth dysbiosis, how could we explain in other words, like gingivitis would be more maybe a common word for the people listening to us?
Yes, I mean, dysbiosis, it could be translated as an imbalance in the mouth microbes that we recognize as healthy, and that is really a combination of
so people that haven't had that tested, they could have, of course, like maybe a diagnostic by the dentist of gingivitis, or they can see maybe blood when they're brushing their teeth. So it's before we go further, just to help people understand if this is for them, It's not normal to have blood just by brushing your teeth, correct? So that's a sign that there could be an imbalance, right?
Yes, anything that is related to inflammation in the mouth or loss of any type of a structure. In this case, for example, the most common thing will be cavities. So you start losing your tooth structure. All those things are related to dysbiosis. Inflammation in the gums, loss of the tooth structure, and those type of events are related to imbalances in the microbiome in the mouth. So that's pretty much what is related to when we talk about dysbiosis.
So you had that gut feeling a long time ago before even studying naturopathic medicine. So it's a little like someone that's going to see why they have eczema on the skin, or we can think about any type of rash or acne. And instead of just treating the skin here, instead of just treating the gums, you were already thinking there's something else to this, and this could be connected to other parts of the body. And that makes a lot of sense. If your skin's not doing well, well, sometimes there's something inside, and then of course the gums are connective tissue. So we're seeing inside our body by looking at those gums. We can't see further. We can't see our knee inside, but we can see inside our mouth. And that's, according to a lot of other medical communities, like if we look at Chinese medicine, they've been looking at the mouth for thousands of years.
Yes.
Right.
Yes. The mouth is one of the most important assessment tools. For understanding what's going on in the body. And Chinese medicine and other type of ancestral Oriental medicines, they acknowledge the mouth as one of the most important areas of the body for being in balance. And it makes sense. This is the entry point. This is an open system. We are an open system. And this is the entry point. It is one of the most connected places of our body, besides the skin, that provides information and modulates immune responses and many, many other things with the rest of the body. So we are in constant exposure to environmental factors that then they are driven and they're internalized, so we can create the proper responses that we need for being adaptable. Because everything is changing in a constant basis. We don't even notice, but from temperature to weather to oxygen amounts to the microbes that are coming in, it's just a matter of moving a little bit from one place of your house to another, or even traveling a little bit further. You will see the body will recognize those changes, but needs the proper information to understand what to do. This is the entry point. This is our antenna. And that's why it's so important to keep it functional. Now, unfortunately, because it's so accessible, we are always disrupting this area. We're always putting things in the mouth because we have this germ theory, this interventionist concept that we need to do something to prevent disease. Instead of promoting what is naturally occurring, that applies actually to every area of the body. But in the mouth is easier because we can access that area so easily. We are being pushed by the standard care that we need to brush our teeth 3-4 times a day, sometimes more. Use a lot of different types of products, which have a lot of nasty components there, and ingredients like fluoride, like titanium dioxide, like antimicrobials, and so on. And we do that frequently. Now, if we put right now, we're a little bit more aware of how important the gut microbiome is. Like if I go to a conference and I have the possibility, let's say I have a door here in the middle of the gut to access this place, and I will tell people, look, what we should be doing is just this rubbing and brushing and cleansing your intestines like every day. Sounds gross, I know. Fortunately, I already put the mental picture probably in everyone, but the idea here is that will be like, no, we know that those microbes are important. We need to take care of them. We're starting to even believe that antimicrobials are not that good for us.
So because of that germ theory, and we're so scared of germs, well, people are using antibacterial mouthwashes and specific treatments sometimes that are antimicrobial, and eating those gums or those mints that are antibacterial, and like you say, like maybe brushing their teeth even maybe too much. And so we're trying to kill something that's bad, but we're also killing the good that's important to maintain that health in the mouth.
Exactly. So beyond the conversation of the diet, which is huge, and of course the environmental toxins, which is another huge factor for maintaining balance in the mouth, we take those things apart. We can't, but let's say for a minute those are not important, and we just focus on the mouth microbiome. We are destroying and disrupting those microbes so frequently that the only two things we're going to be creating is more defense responses. So we're creating more aggressive patterns for those microbes, and we're lowering the physiological capabilities of those microbes to produce what we need to be healthy. Those microbes are there for a reason. And among many others, they're producing molecules, compounds that we need for functioning properly, like, for example, nitric oxide, which is huge for cardiovascular health.
So that's why there's so many articles in, it's been many years that I've been hearing about this. It's just, I think, more present. But a lot of people that have had heart attacks or have done research about the causes of heart attacks actually link, chronic infections, like post, what is it called in English, when you get that surgery, and then sometimes it actually leaves infection in your gum for years.
Yeah, like
root
canals or tooth extractions that were not treated properly. Here's the thing, like
I knew there was a link, but thanks for explaining. So it's nitric oxide production that comes normally from the mouth that helps the vasodilatation. So we need those good microbes to produce that.
Yes, and it's even more connected, because those nitrates that are going to be broken down for producing nitric oxide comes from nitrates, and nitrates that we find normally in foods. But those nitrates, they need to be broken down first on the gut, and then they travel through enteric circulation back to the mouth, and then they're utilized by those mouth microbes. So now we have this amazing system that has a symbiotic relationship. When we break down foods to a certain point mechanically and enzymatically here, then those foods travel through the gut, they arrive into the intestines, those microbes are going to be breaking down even more those foods, producing nitrates. They're going to travel through enteric circulation back to the mouth. Now, those microbes in the mouth, now they receive this already pre-digested material. Now they can use it for making nitric oxide. And the reality is that situation also happens for every single nutrient that we need in the mouth, meaning that the status of your gut will dictate tremendously how well fed are your microbes in the mouth. You need both in a good place for making things happen normally and becoming healthy. So if you have a dysbiosis in the mouth, it might be because you're maybe not breaking down foods, or you're not digesting things properly, or maybe you're not even eating those nutrients in the first place, and then you're not providing those nutrients back to the mouth to feed your mouth microbes.
Wow.
So gut dysbiosis, mouth dysbiosis are usually one thing.
That's really exciting, because there's so many people that they worry so much. They floss twice a day, and they're like you're saying, they're cleaning their mouth with so many things, and it just doesn't make sense that it's coming back or it's still there. Like I have so many clients that I do a link and I tell them, well, there's something that's not normal. You're not, like, if you're supposed to be healthy everywhere else, why is your mouth not healthy? Like it's not separate from the rest of your body.
Yes. Yeah.
Interesting. So for people that have like chronic inflammation, I mean, it's so common that people suffer and they've tried everything. I mean, maybe they haven't looked, or maybe they haven't really linked what's happening in their mouth. I mean, sometimes people spend so much money on probiotics and their gut, but there's something maybe like you're saying that's recirculating. So what would be the first step for someone? Maybe quickly. I mean, we can't give like a private consult today, but maybe just little tips and hopes maybe for people that are listening.
Yeah. I will tell you something that has been acknowledged since the time I was studying dentistry in the first place. First of all, there's absolutely no difference in terms of inflammatory markers between brushing your teeth with or without a toothpaste. There's absolutely no clinical difference. So we know that from the I'm talking about, this is the 90s. This is not like brand new knowledge. This is really old school knowledge. But why has not been pushed out there? Because there's a huge industry producing this type of product. So that's not really going to be something they would like to hear.
No, and most toothpaste, if I remember correctly, they're not really good for the environment. I mean, that fluoride is getting into our water system in the soils, and fluoride at a high content, it's actually a toxic substance, and it can affect the thyroid, right? So, what's your take on that?
And then a lot of well, actually, there's consistent studies that show that fluoride will lower the IQ of newborns by 10 points at least. That's one thing. The other thing is that it creates neurodevelopment problems. That's something we have seen in multiple research. The amygdala and other glands in the brain, they get affected by accumulation of consistent exposure to fluoride. So when they say, well, but we're going below the dosage that is considered toxic, we're talking about a dosage that is considered toxic in a one-time exposure. But we're looking at a low-grade toxicity that is being created over years. So people, they're getting exposed to to mouthwashes, to toothpaste, and to tap water, which is also in most of the countries here in the West, they intentionally add fluoride. And you get all these multiple sources, and that gets accumulated in the body. So it's not just like we're going in a lower dosage for fluoride. We are getting a huge amount of accumulation in different types of forms of fluoride.
So now the research is suggesting that cavities and the teeth health and all those minerals can be deposited and can be protected by other mechanisms in the body. So we don't have to go to fluoride, right?
No, actually, there's a way that the tooth will grab minerals, and it will replenish, or it will do the remineralization process that we're looking for with fluoride, which is actually not really an efficient one. The most important part here is that the brain controls the way that the tooth is going to grab minerals, and it does this by controlling the centrifuge force that is created inside the tooth structure. And if that's spinning on one direction, that will grab minerals from the environment. But if it's spinning in the opposite direction, it will actually release minerals from the tooth structure into the environment. There's a whole buffer modulation that is related to that. But the short story about it is that there are certain nutrients, like, for example, vitamin K2, which has been demonstrated that regulates that centrifugal movement. So if you're lacking of things like K2, you will probably be depleting your tooth structure from minerals, causing demineralization and starting the process of decay in the tooth. So
I think I had read about K2 also for the gums, but I don't recall which study that was.
Yeah, well, that's huge also because K2 is one of the pivoting points for bone growth and bone regeneration. So, and also for the development of the bone. And the bone, the jaw is not woven, meaning that it never matures fully. So you know that when we grow, like for example, we see any other long bone on our body, take a rib for example, they are getting calcified and they develop up to a certain stage of our lives. Then that's fully mature, and the bone structure solidifies, and it can't grow or it can't adapt anymore. It can repair, but not really is going to be changing the structure in terms of shape or size. That doesn't happen anymore.
Okay.
It is what it is after a certain moment in your life. The jawbone, that rule doesn't apply. It's always adaptable. It never matures in full. So we need a lot of nutrients for moving the tooth structure, the bone structure. We need a lot of nutrients that modulate that type of growth pattern. So yeah,
Okay.
we need that capability for keeping that bone plastic. Because if you lose a tooth, if you have an accident, if somebody has an accident and the bone suffers a problem, this needs to be repaired. This needs to have the capability for being repaired, because this is such a crucial structure in our physiology. You don't have this, you don't eat.
So it's constantly getting repaired, like our gut. So it needs a lot of nutrients. Do you want to name just a few to maybe give a little enlightenment to the people that are listening?
Probably there's absolutely no nutrient that we require for other physiological needs that this is not needed for the bone. But I will say that the most efficient ones, and that I think that's the crucial point, the things that we're not really getting in good amounts in the standard diet, and especially the standard American diet, would be magnesium. Magnesium is huge. It's like for everything.
So even for the microbiome, like or you're talking about more the teeth as like a similar to bone structure?
Yes. So it's everything, because magnesium is the one that regulates the calcium levels in the body. So,
for sure. But I was talking more about people that have like the infections or the problem with the microbiome. So what kind of nutrients could help maybe more the gum itself by protecting itself from the bacteria, and to maybe have like a better microbiome?
Okay, so for the gums, that mainly will be what is nourishing the fibroblasts. So we have these cells that are quite cool actually in the gum structure, and we have it all over the body. But in the gums, they're quite active, and they are producing different types of collagen. And we know that is highly needed to have good levels of vitamin C for producing collagen. Actually, a lot of people that are looking for glowing skin and collagen, and they're taking collagen, well, it's much better if you feed your fibroblast with vitamin C from the inside, and you enhance your production of collagen from the inside, and trying to put collagen inside your body, which is actually pretty complicated.
Well, yeah, when people, I mean, eat the collagen, the body has to reuse it and put it.
Yeah.
You want it in your face or in your gum, so it needs vitamin C to reuse, even if you eat collagen as a supplement, right?
Yes, vitamin C is highly needed for the metabolic activity of the fibroblast.
Okay.
But also, I will say that vitamin A, vitamin D, the vitamin D3, which is more than a hormone, but still, and the B complexes, they're highly needed for gum health. Actually, in certain schools of biological dentistry, there's injections you can put in places when you have surgery, for example, with that you put vitamin B there and other nutrients to enhance repairing. So we know the B complex is a huge deal. And all these vitamins are highly found on meats and along with, of course, certain vegetables. That's why our digestion has to be so optimal, because we break down different foods and we absorb different vitamins and nutrients all along the digestive tract. So you want to have a healthy mouth, you need to have a healthy gut. That's a must.
Yes, and so many people have, gut issues or digestion that's very slow. People are complaining of reflux or, like nausea or constipation. So those are all signs that they're not breaking down or absorbing the nutrients. Let's say they have, dry skin, or their hair is not quality, or their nails. Well, that's all a sign that they could be lacking those nutrients that are going to be used also by the gums.
Yes.
Okay.
Yeah, that's true. That's why, again, digestion is a crucial piece of the puzzle. Healthy mouth.
I had heard about zinc, and we know that with age, people absorb less and less zinc because of a lack of hydrochloric acid, because the stomach ages and produces less. And we know that it's also less produced when there's stress, of course. So do you see also a link with zinc?
Yeah, I mean, if again, in the route of nutrients, everything is highly needed. This is a highly active place in the body. The repairing rate here is so fast, and there's so many things happening here in any given moment that we need a lot of nutrients for making everything happen and our cells to become active and metabolically efficient. And that will give, of course, your microbes a nice place to live. So it's all connected.
I get questions sometimes about peroxide, because we've heard about peroxide during COVID, because it was, a lot of medical doctors were interviewed about how to disinfect to prevent the complications. And I don't remember the name of I think it's nebulization of the peroxide for the nasal cavity. So I have people sometimes asking me, what do you think of peroxide? We know it whitens the teeth. And how do you feel about peroxide? I mean, I know it's an antibacterial, but will it disrupt the good microbes as well?
Yeah, I mean, there's absolutely no selective mechanism for lowering microbes of a certain kind and not others. Like most of the microbes, they share a lot of characteristics in common, and they get affected by the same mechanisms than every other. So if you are breaking cell walls, you're going to be breaking cell walls for every single bacteria, not only for the bad ones. If anything, we have seen that the most adaptable forms of microbes usually tend to be more pathogenic when they are in larger numbers in certain areas of the body. But peroxide can be used actually in a very small time frame and in a very localized way for lowering certain types of bacteria that we recognize as more anaerobic. And I will say that will be my preferred way, or one of my preferred ways, when I see that type of imbalance. Of course, the root cause is not the local problem. It's not those microbes growing there because they found, like, they decided to make a party in that gum. It's just because we have an imbalance in the gut, and usually there's a systemic issue that is driving that imbalance in that localized area. But in the meantime, it could be a good alternative, for example, for irrigation of peroxide, 3%, and in that area for, let's say, a week time frame. That's it, to regulate the growth while you're fixing what has been determined as a root cause. Or you can do that sporadically whenever you see something that is going off. But always keep in mind that is a sign of something else, that there's another layer that we need to take care of, because that's not happening just because the mouth got an issue. That's not the cause.
Exactly. And we talked just before the interview about hormones and that study about endometriosis.
Mm.
I think I'd like to maybe cover that before we end today, because there's so many women suffering for that, and there's not a lot of solutions.
Yes.
There is a global approach that helps to reduce, but some women have it very strong. So I'm sure they'll be interested in hearing how maybe their mouth health can help reduce that.
Yeah, I will do a little bit longer explanation because I think that this is a good opportunity for creating awareness of things that we're using on a frequent basis, and they can be leading to this type of conditions. There's definitely a problem with the overuse of PPIs and antacids in general. We're used to use them for every time we get symptoms of acid reflux or GERD or anything that's related to acid coming up.
So for my French community that's listening, you said PPI, right?
Yes.
In French, it's inhibiteur de pompe à proton. It's just the medication that we give to reduce the acid. So once again, it's symptomatic, but it's not treating the cause, and it can cause issues long term for sure.
Yes. So the problem is that what we have in the mouth needs to stay in the mouth. And we have certain bacteria coming into the gut, but they're supposed to get killed before they arrive into the gut. And that's why we have the stomach acid barrier. The stomach acid barrier probably is one of the most important filters in the body. So it kills whatever is coming from the outside, that it doesn't need to arrive alive inside the gut. Well, the problem is that we're neglecting that by using PPIs and antacids. And also another major factor is that everyone is, unfortunately, highly stressed, which is another driver of low stomach acid. So all these factors combined, they neglect this barrier, this filter, and now we're passing microbes from the mouth into the gut. That already is a problem and can drive multiple conditions. Now, what if this low acidity is causing also nutritional problems in the body, and that is affecting the mouth microbiome? Now we're going to get different types of microbes. Later on, like probably in the process of this imbalance in the body, we're going to have more dysbiotic bacteria. And some of them are highly recognized as drivers of disease in other parts of the body. One of them is a group called Fusobacterium. The name's not really important, but we know that that group of bacteria are highly related to periodontal disease. But also,
we'll put the name of that bacteria below the video so people can Google it.
Yeah, definitely. It's super interesting because that bacteria, along with other groups that are being researched right now, they can pass, if they pass the stomach acid barrier, which again is related to everything that we explained before, they can colonize and they can go to different types of parts of the body, different organs, and they can trigger inflammatory reactions that are way beyond the normal. If they go to the liver, they can cause non-alcoholic fatty liver. If they go to the pancreas, they can cause pancreatic cancer.
Wow.
And in the uterus, they can travel through enteric circulation, by the way. They can cause endometriosis. So
it's incredible because some women, get told that there's nothing that they can do, and that they don't know that that the cause is unknown, and that sometimes they just end up taking full of anti-inflammatories and just suffering. I mean, so that's really, really good to hear. I'm so happy we're doing this interview, and I'll pass this information on for sure.
So what we need to become aware of right now is that if nothing really worked before, one very good idea for trying to fix these problems, and this is related to multiple types of conditions, is fixing your digestive system, fixing your digestive efficiency, improving the functioning of your liver, your gallbladder, your pancreas, your stomach acid, not suppressing those organs. Just there's so many beautiful botanicals. There's I can name a bunch right now, like dandelion root and ginger and turmeric and peppermint and so on. There's so many things. Digestive bitters are amazing. Like all the things that we can find in the bitters blends, they're fantastic. All those things are going to push your digestion into a better place. And we might correct to a certain degree, and why not maybe in full, the issue that is causing the imbalance in the mouth and also in the gut. Now, of course, there's sometimes we need to also be aware and take action locally in the mouth. I'm a huge proponent of not brushing your teeth all the time. Just maybe once a day is fine. Do the experiment. See if toothpaste is really a game changer for your oral hygiene. Like, check it.
Well, I think people, if they avoid the toothpaste, they actually take the time to brush more, to get that sensation of cleanliness from, the mechanical movement. And it's actually like a false impression with the toothpaste. They do it really fast. So I think sometimes people actually underbrush just because of the toothpaste. So that's a really good idea.
Yeah.
And maybe two things that we haven't covered really, really fast that I'm sure people want to hear about is, the breath, because a lot of times it doesn't come from the mouth. It comes from the gallbladder and digestion, but also the production of du tarte. So you're saying to brush your teeth once a day. Even myself, sometimes after many hours, we don't feel clean, as if there's already a deposit on the teeth. So is that also caused by the bacteria? And do you have really quick suggestions before we let each other go for today?
Yeah, for the tart, for the calculus on the calcified deposits in the teeth, usually that is related to a nutritional imbalance. If you have calcification in your teeth, that means you have calcifications somewhere else. And we know that there's many drivers to that, and usually are related to inflammation. So we need to be aware that excessive calcification in the tooth structure, it can be a warning sign that we're imbalanced in our nutrients. And that includes proper amount of magnesium, D3. We know all this K2, all these things are modulating where the calcium goes, how it's eliminated from the body, on where it's going to get deposited. So we know there's...
I had heard also, if your saliva is too acidic, which is not normal either, which is all connected to how you're absorbing your minerals and how you're fighting, the acidobasis homeostasis in your body. So if your saliva is too acidic, it also drives, I think, the minerals to be present to fight that. Is that possible?
Totally. And always keep in mind, bile, which is like a huge part of your liver function, and gallbladder is one of the most important buffers you have in the body. So
and so many people are not producing enough bile. Like, that's what I teach, in almost all of my conferences. Everything is linked to bile production.
No, I see that every day.
Okay. Interesting.
So yes, that's a huge piece.
And when that's not being produced enough, well, there's a congestion, and people oftentimes will have like a slow digestion, and then they complain of bad breath, and they try to clean the mouth, but it doesn't actually come from the mouth most of the time, right? It comes from below.
So usually when you have food sitting in your stomach for too long, and you have imbalances in the way that you digest foods, you usually create fermentation that leads to the release of certain gases, and that includes hydrogen sulfide, among others. But also, if you have a local infection, and again, it's never local alone, but if you have some factors of overgrowth of certain groups of bacteria, especially gram-negative anaerobic, those tend to be more productive for certain gases that they will create a foul smell. And so that's where local factors and systemic factors, they need to be addressed in conjunction. And unfortunately, when you go to the dentist, they never look beyond the mouth. So you never get full resolution of these problems, because you're only putting makeup or trying to take out whatever is locally affecting that specific area, but you're not really fully resolving the problem. And
Exactly. So it's like makeup on dirty skin, or I heard another doctor saying nail polish on dirty nails. Like they're
yeah,
still dirty underneath. So that's the
exactly.
same thing when we're trying to take those gums or chewing gums, I mean, or everything that for the bad breath, we're not fixing the cause. Yeah.
No, fix your digestion, stop the over cleans, cut down all these antimicrobial products. Let your mouth do what it needs to be done, and eat nutritious foods, a well-balanced diet, and make sure that you're breaking those foods down so you will feed your mouth microbes as well. And with that, you will cover probably 80% of the problems. What the other thing I will put on the side that is a huge factor for keeping your mouth healthy is the breathing pattern. So, and there's so many people snoring or breathing by the mouth. So that's actually something that needs to be addressed, because that changes completely the way that we keep the homeostasis and the balance in your mouth ecosystem.
Wow. Do you have maybe some references that people can look up for the breathing, since we're not going to have time to go in that detail today?
Yeah, there's a great book actually. It's called Breath. That is
Yeah.
amazing, and I think that's something I definitely will recommend to read.
Okay.
Mark Burhane, he's a biological dentist. Also, he speaks a lot about this, and he has a book about it too. So you can find it on Amazon, and he has a really good website that's called Ask the Dentist. I think I mentioned him because he's really doing a really good job in creating awareness about this type of problems and the connection with mouth disease. And so you can look him up, and besides that, there's some mouth taping techniques that you can find easily online. There's a lot of products on Amazon or other websites that you can get for trying to correct your breathing patterns. And some people, they will need more professional help and a good assessment. But I will say this is a huge deal. Even these Oura rings that we're looking for that can check or track the sleep patterns can tell you how much deep sleep you have, and that can be actually related also with your breathing patterns, especially at night. And if your partner is complaining that you're snoring at night, well, you already have a huge indicator that that's not going well.
And it's funny because a lot of times when you fix the digestion and you fix the systemic inflammation, people actually stop snoring. There's a big link with digestion, so it's so interesting that everything linked to that.
Yes, pharmaceuticals, alcohol use, and well, of course, tobacco use, but also acid reflux can drive snoring patterns or mouth breathing patterns.
Oh, thank you so much for mentioning it. Yes. I mean, I have a whole article, it's in French though, about the stomach and how important it is to correct that acid. So thank you so much for mentioning it, because I think people sometimes forget the basic stuff.
Yeah.
Even sometimes therapists that I talk to, they try to, fix something too fast, and we skip this, and it's so important.
It's easy to fall in this belief that it's complex because we see it as complex in terms of symptoms and the standard solutions that are given. But I will say that a huge amount of problems that we can see from the oral microbiome, the gut microbiome, and other things involved that are related to this, to major areas of the body, they can be fixed by taking care of very simple things. Sleep, exercise, diet, and putting things in your body to stimulate every organ that is related to these functions. And those are cheap. They're so inexpensive. You can get them for nothing. And they will become so potent in your daily routine. I'm not saying some people, they need more support for a certain amount of time. That's so understandable. Sometimes we need to regain our health with more strong strategies because we have been doing the opposite for so many years. We have been exposed to things that are driving imbalances in the body that are deeply rooted, and that needs more intervention. But on an overall basis, a lot of things that we can do for taking care of our health are there, like reachable and they're not expensive, nor complex, nor risky. And my daughter, she's almost 3 years old. She takes botanicals, herbal teas and things for digestion. So nothing will happen. This is, of course, with criteria, common sense, they're completely safe.
Yeah, I mean, we need to, link again all what's out there in nature that can help us. And that, I mean, even animals, they eat so many things in the grass that's bitter. It's just, normal. And we've lost that, reflex of going towards bitterness. And we definitely have to bring that back. So thank you so much for all that precious information. For people that want to know more about the gut microbiome, there's our first podcast together where we explained how, strict diets like keto can actually affect negatively the microbiome on the long term. So I really recommend everyone reaching out and finding our recording that I'm going to link below the video, which is either on YouTube or my YouTube. And people can actually reach out. You have a company now to help people with their gut microbiome and their mouth microbiome. And you have a team that can help the people that are looking for a therapist, right?
Yes. We have a company that can help supporting all the things that are needed for balancing and regaining health. Because at the end, this is one of the main areas of your body that needs to be rebalanced for regaining health. The company is called Revolution Gut Health, and so the website is revolutionguthealth.com. So you can find all the information there, and if you have questions, you can reach us out anytime. We're happy to help.
Excellent. And don't be afraid if you're not from New York and the United States. It's all online, so I presume you can help our fellow people here in Canada.
Yeah, this is an online platform, and it has services provided for worldwide. So actually, we have people coming, reaching out from everywhere. So yes.
Okay, great. That's good news. Well, thank you so much for your time. That was so interesting. I know we can talk for hours, but it's almost been an hour. It goes by so fast when it's interesting. So I will let you enjoy your evening.
Thank you so much.
Thank you for being with us. And I will link all your website and the subjects we talked about below the video.
That was my pleasure. Have a beautiful night. Take care.
Thank you. You too. Take care. Bye-bye.